All right, good afternoon, ladies and gentlemen. I am yours truly, James Hayes Jr., a health interventionist and intervention specialist here at Man to Man. And today I have a very special guest. I'll let my guest introduce herself. But today we're going to talk about COVID-19.
Hi everyone, my name is Pender and I am the project director for the South Carolina Center for Fathers and Families. So I help to take care across the state different fatherhood programs. But I'm also a family nurse practitioner and a certified pediatric nurse practitioner. So we're going to talk about this coronavirus 19 today.
All right, and I'm really excited about it. And being that you mentioned the fatherhoods, we do want to give a shout out to the Center for Fathers and Families, also a Father's Place, Father to Father, a Father's Way, Upstate Fatherhood Coalition, Midlands Fatherhood Coalition, and of course Man to Man Fatherhood. Shout out to all the fatherhoods across the state of South Carolina. We appreciate all of your hard work and all of your efforts, especially during COVID-19. That has changed our way of life, and we don't know for how long, maybe permanently, but it's definitely changed our way of life. Shout out to all the fatherhoods. Also, we want to encourage every person to like, comment, and share our Facebook page. If you're watching right now, we ask you to click the share button so that all of your friends on Facebook will be able to follow along as we talk about COVID-19. Also, you may visit our website, www.mantomanfathers.com. That's fathers with the S.com. A healthy father is an asset to his family. Well, I guess we can start with some questions because I have a number of questions that I want to know about COVID-19. I'm sure all of our listeners have a number of questions. But I'll start with this question. What exactly is COVID-19, the coronavirus? I don't know if I should say coronavirus, COVID-19. What exactly is it?
Okay, so coronavirus is actually the virus. So 19 means that in 2019 it was identified. So it's what we call a novel virus. That means it's brand new. We have not seen it in the scientific world ever in the history of our science in identifying certain kind of viruses. So it is a brand new virus. When we talk about COVID, COVID is actually disease. So coronavirus is actually just the virus, and then once it gets in the body and it starts monkeying around and it causes disease, then you have COVID. It's also, when we talk about when we talk in the scientific terms, it's called a SARS virus, which stands for Severe Acute Respiratory Syndrome. Okay? SARS. So this is a SARS-CoV-2. Why is it a CoV-2? Where did one? Right, we've had it before. About 18 years ago. It's been a while. So we've had this virus, this sister virus before. But this one again, remember, it's a whole new one. It's a novel virus. The sister virus was actually more deadly than this one is turning out to be.
Really?
So about 1 out of 10 people were dying of it, but it wasn't as contagious as this one is. So it didn't spread as quickly or fast. Now, why do we not have SARS-1 anymore? We're not really 100% sure scientifically. It did just kind of disappear and didn't become a pandemic. Like this one's a pandemic, so it spread across the world. It didn't do so much, so it kind of fizzled itself out, it looks like, over a period of time, and it didn't do so much. So as part of the coronavirus family, people are wondering about what's a coronavirus. Well, when we talk about cold viruses, there's different viruses that cause the common cold. One of them is a adenovirus, and another one's a rhinovirus, and another one is coronavirus.
So we got adeno, rhino, corona.
Okay. So a corona likes to drink Corona. I don't know what it does. But coronavirus family. So when we think about that family, it causes respiratory problems. So that's how it travels, the respiratory system. So just like the common cold, it's hard to treat sometimes and it's hard to tackle. The same thing with this one, but this one's got sort of like a virus on steroids, so it's a little bit more. So it does cause more respiratory issues. It does seem to be worse in our older populations. They seem to have it tough. So our nursing homes, well, one big thing we've learned from this, and this is a horrible thing to happen, But our nursing homes have really been affected by this, because once you get a bug into a encapsulated place like a nursing home or prison or even a hospital, it's very hard to get rid of because it's contained in that area, and then people breathing in the same kind of environment. It's kind of tough. So we've had a lot of people in our South Carolina, especially, a third of our deaths and a third of our people that have actually gotten this have been in our nursing homes. So it's a problem. Also, since we know that it's respiratory wise, people that tend to have more problems with this virus are people that have more respiratory issues. So like your asthma, your COPD, also smokers. So smoking actually causes a problem, because with smokers you have chronic inflammation, chronic swelling in your lungs, and it irritates everything. So it sets up for this. Also, a weird thing about this coronavirus is that it tends to love not only the respiratory system. Once it gets into the body, it likes the cardiovascular system or the heart system. It likes to cause problems. So if you already have cardiovascular disease, you're more prone to have a worse outcome when it comes to this virus. Another thing, they did a study on people who had actually died from this particular thing, and they found out that half the people in the study had high blood pressure. So one thing I'm encouraging, because in South Carolina we're a big problem with high blood pressure, keep that high blood pressure under control.
You just scared me.
I don't want you to scare you. Just get with it. So high blood pressure is an issue.
Right.
Also, obesity. We just had, I think, a 16-year-old in the United States the other day to die from this, and we haven't had very many children to die from it. But he was morbid obese. That was the only thing that he had going on that was a problem, and he was morbidly obese. Diabetes also. Diabetics do not do very well when it comes to this virus.
Really?
So,
is that type 1 diabetes, type 2, or both?
Both. Diabetes is an all-body kind of disease. It's not just the pancreas and dealing with insulin. It even affects your eyes. You can go, blindness and stuff. It affects your circulation and things. So remember I told you it likes that heart system, that cardiovascular system. Well, diabetes also weakens the cardiovascular system. So we think that might be why the big link there.
Now, many people have asked me personally, do we expect a second wave of coronavirus? And the only thing I've been able to tell them, well, numbers are spiking now. So when you say second wave, I don't know if you mean
how many
now,
waves?
later. Or
Yeah. And to be truthfully honest, from what the scientists are telling us, we're still in the first phase. We're still in the first wave. And they're not expecting that wave to end till probably about August. But we may not even see a dip. We may go right on into the flu season and in the fall, and we may continue to run higher. That's the reason why it's so important to personally protect yourself, and we'll talk about that. But like James and I are 6 feet apart, that's social distancing. We're social distancing, so we're not wearing masks at this point.
We have hand sanitizer.
We do have
that
hand
we made.
sanitizer.
We have the spray that we can put on and make sure we sanitize down.
Use it. But the best thing is actually soap and water. If you can get soap and water and wash your hands for 20 seconds, that's better than even hand sanitizer, but sometimes we can't get to that. So
now how did this virus get here? Because I have a hard time understanding.
Right.
How did it travel here, or did it start here? Did it travel?
Things travel by planes, trains, automobiles, and boats. Okay? That's how they travel kind of across from where they come from. In December 2019, there was some information that was coming out of China that a lot of the clinics and things were noticing in this little town called Wuhan that there were people coming in with this weird kind of pneumonia. And it had a dry cough to it, a little bit different, and they had a good fever with it. But when they tested them for, influenza, the flu and stuff, it wasn't that, and they didn't know what was going on. So they did start documenting it then, supposedly. But we believe it was in the country probably a much longer than that, because it takes a while to start seeing people come through your doors before you start saying, hey, this is a little different, what's going on. Right. So they finally, towards the end of December, so around Christmas, when everybody shut down, they finally did tell WHO, which is the World Health Organization, hey, we think we got an issue here. We think we got a problem. And so in January 2020, outside of Wuhan, China, in that area, there is a seafood market. And they sell weird stuff that we don't eat here in the United States, but believe it or not, over in that area, they actually eat bats. And they eat Padawan things, these weird type of animals.
A drink to that.
So, no, I'm not going to in there. But they eat these things. Wow. And one thing about bats do carry coronavirus type strains to it. And they noticed this strain was close to one that comes into bats. Wasn't quite a perfect link, but close. And so the suspicion was that maybe people working with these dead bats and getting the virus, that maybe this virus had mutated and actually come into human form, come into humans. That theory, though, is looking like it may not be true. We're just not sure. There also is a virus lab in Wuhan where they actually study coronavirus and different viruses.
Could have been created in a lab.
It could have been there, but they're still checking that. So it's really not sure what. And but at least we're finally opening up the doors to be able to look at it. Now, when you're talking about China, you're talking about Red China. You're talking about a communist country. So a lot of times they don't want people to know their dirty laundry. So a lot of things they weren't telling us that we would have sure liked to have known, that things were going on that might have even helped us here in the United States, maybe not to have traveled so far, but they were very careful about it. In January, though, a dignitary from Wuhan went to Thailand, and that's when Thailand actually, they started having people having it, and they realized, oh, this stuff's spreading. But now we're actually seeing some data coming through that may have entered the United States even before December in the United States. We just can't quite prove it and track it.
You know, I have people that tell me, that swear they had this prior to it becoming, you know, a thing here in the United States. They tell me 2019, you know, as far as October, November, December, they had the same symptoms.
We wonder, and then you got to understand, though, it was coming directly from China is where this particular one was coming from. So it'd be more on the West Coast. There are other viruses, and sometimes virus can mimic another one. Influenza can mimic this to a degree, but usually the flu has more of a phlegmy cough to it.
You don't want the flu.
Yeah, you don't want the flu. So therefore, the first confirmed case wasn't until January of this year. So we had our first death actually recorded in February here. So it's our first positive. So the reason why I'm telling you this is we feel like this has gone on for years because so much stuff, so much information. But to be truthfully honest, this is June. I mean, in February is when we had our first recorded death of this. And then in March the 11th is whenever World Health Organization realized across the world it's spreading. It's really going fast. So this is one of them. Planes, trains, automobiles, and boats. It was really coming fast, and that's why the government had to really shut down things. And they did try to shut down things pretty early with China, but this is really contagious. And April the 7th, people don't realize this. This is June. But April the 7th is when we actually did our shutdown orders, our stay-at-home orders here in South Carolina. It was April 7th.
And it seems like shut down forever.
It seems like forever. So on May the 4th, so April the 7th we shut down. May the 4th we started opening up again. So we were really on a month, but we think that it's like forever. Now there's still some things that are sort of shut down. I know the governor is now opening up more with bowling alleys. They're already talking about theaters. But of course, this is a free country, so it has to do with how places feel, and if they feel like they have enough equipment to clean things more. We do have guidelines from the Center of Disease in order to try to stop this spread as much as possible.
Now, how do we get this virus?
Okay, so it's mostly between people with close contact. So that 6 feet is a big deal, okay? But even when we talk, so as I'm talking here, if I were to do a certain test and turn out the lights and see basically how I spray my respiratory droplets, my spit, it would go out. farther than you think. Yeah, he's going to move away from me. It go out for a far way. If I sing or yell, it could even go past that 6 feet. So that's the reason why it's real important. We noticed that churches were getting shut down, and they had like choir practice. This one church actually had choir practice, and 85 people got infected. 85. Because one person had it and evidently was singing, and 85 people in that choir practice got it. That's because it actually propels that respiratory droplets out. So it's by respiratory droplets is how it's transferred. So if a person coughs, if they sneeze, they talk, yell, anything like that, it's by that. That's how it's done. So also it could be transferred by touching infected surfaces and putting it to your face.
So that's why it's so important to
wash them hands, because we're always going to touch our face. We try to do the best we can with it. I know I tried one day and I thought I was going to go insane by the end of the day because I knew I'd touch my face, because I put something on my hands. I put white powder to see if I'm really touching my face. By the end of the day, I had white powder all over my face. So you just do the best you can with that. But that's why the hand washing is so important. So it's by respiratory and airborne transmission. They have done studies on this. It is not transferred by blood, by feces, so like changing a diaper or something, or by urine. It is not transferred.
So with wearing the mask, right? So would you suggest everybody wear? Because when it first came out, they were saying you don't need to wear a mask, and then they say wear a mask.
Right.
So where are we now? Do we wear the mask? Do we not wear the mask?
I know. That brought a lot of confusion, and I think a lot of distrust with the Center of Disease Control. And I hate that, because what was happening, believe it or not, is that people were buying up the materials super quick. And especially, I have a friend of mine from Malaysia. He had already known about it in December, about this happening in China. He bought up cases for his family up in New York. So they were stockpiling equipment that we needed, things we needed in the hospital to take care of you. So what we call PPE, personal protective equipment, the certain masks, the N95 masks, the gloves. Gloves are mainly made in Malaysia, and all of them shut down their companies, so it's really hard sometimes to get the gloves. And all of the equipment, the shields and things like that, they're made overseas. And even China, they knew that it was coming, right? They want to keep their stock. They make it. They want to keep their stock. But then there also could have been some things of wanting to jack up the price of the United States.
Which is why we should make it here in America, right?
Right, make it in America. And then also with the ventilators and things like that. But with the mask thing, is the Center of Disease Control was afraid, and that was already starting to happen, is we wouldn't have enough to take care of people that really needed it in the hospital. Okay. We've had over 300 healthcare workers in the United States to die for taking care of people who have COVID. Okay, 300 people of people like me, nurses especially, being on that front line. And they've got to have that equipment in order to take care of people. But that's why. So now we're talking about, we do know from studies that these cloth masks work. They do help. They're not 100%, but they do help, not only that you give it to somebody, but also that you get it yourself. So
symptoms. Say, can we tell if someone has coronavirus? Like, how do you know the symptoms, or what are the symptoms of the coronavirus?
The sad part is we know at least 5% have no symptoms at all, and they have this virus. That's the reason why it's a sneaky thing. It's like a wolf coming into sheep. It actually has, it's a Trojan horse. It actually can hide itself into certain people, and they have no symptoms. They're like you or me, and so I don't know if I have it. He doesn't know, and that's why the 6 feet is important. I may not can look at a person to tell, but it usually runs a pretty good fever, and it usually runs about 103 plus. And adults usually don't run a fever. It's really rare that we do. So it's usually something that we need to pay attention to if we run a fever. Now, a normal fever is over 100, okay, for an adult. But for this one, it runs a little higher.
So my normal fever should be between...
Your normal temperature should be below 100.
Below 100, okay.
So right now, CDC says when we check you, like coming into a building or something, if it's 100.4 or higher, don't let that person in. And that's where they've done many, many studies and many, many people. They know that that's kind of the breaking point, and don't let them in. So it does usually run a fever, but most people are saying it's a pretty good fever, like 130 and stuff when you really have it. The cough is usually a dry cough, so it's really kind of hacking. And it can have shortness of breath, and it's really scary. People say that, I can't catch my breath. I can't get it, and that's why you saw so many ventilators coming through. We're being a little bit more cautious with the ventilators because we learned from this not to just pop them on the ventilator of shortness of breath. Because one thing about it, it's not necessarily shortness of breath because of what we call mechanical means. In other words, in asthma, you have problems with your airways getting smaller. It's not so much that. It's that the cells itself aren't able, because the virus monkeys with it, isn't able to carry as much oxygen. So they might put you on a high pressure oxygen, might help better than ventilator. Yeah. But if the person is dying, you got to do the best you can.
I hate to say, but I was saying put them on oxygen instead of ventilators early on. But
the oxygen goes with the ventilator.
But it was having this big debate about ventilators, and I was like,
And that was some of the information we were getting.
I was like,
and it's better to have it than not.
That's true.
But you sure don't want to be looking for one.
That's true. That's true.
But yes, that's true. Also, the person tends to have more problems with chills, of course, because of fever. And a lot of them are describing muscle ache. It's real deep muscle pain, and it makes you hurt really bad. Headache is very common with it because viruses many times do cause headaches. It can have a sore throat, but here's a weird one. A new loss of taste or smell. I had one person where my husband works, and she woke up that morning and she couldn't taste or smell her coffee, and she knew something wasn't up. Had no fever, no nothing. But she went right on, got a COVID test. Now that afternoon she started developing a fever. But her first symptoms was the taste of smell. And that's a weird thing about this. And some of them, even when they're getting over it, they may not have the taste or smell. And we're hoping they'll eventually get it. But again, this is kind of early. We hadn't had this thing very long in the United States, so it's not.
If I may go back real fast about the mask.
Yeah.
Because I just thought about it.
Yeah.
I see a lot of people driving in their car, and they have the mask on, and they're driving.
Looks cool, doesn't it? Looks like a bandit going to the bank. Yeah.
Would you suggest having a mask on in the car, especially if you're by yourself? I mean, does it make
If you're by
difference?
yourself, there's nobody there. So it's only you and your spit and germs. So there's no reason to wear a mask. And to be truthfully honest, these masks, you're going to have to take breaks from the mask. I see people working in a grocery store and they're wearing them all day. I usually go to the managers and say they need more frequent breaks because they need to go out and take it out and get the fresh air. Because you're actually breathing in your own junk. You're breathing in your own carbon monoxide.
So. Yeah.
I used to do surgery. Some surgeries were over 12 hours long. And I'll just tell you, you have to really, really have tears in your eyes when you have those on for a long period of time. It's very, very hard. But you think about it. There's nobody in my car, so it's just me. Now, if you pick up Grandma, and let's say you hadn't seen Grandma didn't live in your house, and you hadn't seen Grandma in a while, and you're taking her to the doctor or the hospital or something like that, you need to wear it, okay?
Right.
So if they're not in your normal household where you're going around with each other anyway, then you do need to wear it. But when you're by yourself, unless you're, going to go rob a bank, you don't need to have that on. And you need to have some of that good fresh air to breathe. But another thing, going back to it about the symptoms and things, we know about 5%, like I said, at least 5% don't have symptoms. And really about 70 to 80% have very mild or moderate symptoms, sort of like a bad cold kind of idea. But we know about 15%, and we can't tell you exactly who's going to be the one, can have this severe symptoms. And about 5% of those end up in the ventilator and possibly, about 3% could die. So that's the reason why the flu is different. It's a little bit more mucousy. Yeah, it runs a high fever and stuff. It usually doesn't have shortness of breath until you could possibly get pneumonia. Both you can have pneumonia with. I'm telling people, though, right now, please, when the flu shots come out, get your flu shot. we want to totally delete that, get that out of your way, if at all possible, so that we can handle this when it comes into it.
So, on average, I'm a numbers guy. So I like numbers and figures. How many people get the coronavirus or will get the coronavirus? Is there a figure or an average of people getting the virus?
This thing's so contagious that each person is susceptible to getting it.
Wow.
Okay, so each person is susceptible to getting it, and that's the reason why you've got to have those barriers, that 6 feet, the mask, and things like that. This one likes to stick to us.
So how often should we change our masks?
Like you change your underwear, and I hope you do it every day. So Mama said, change it when you go out. I get a fresh one. I have a drawer, and I have a fresh one. I put one on, go out, I come in, and I throw it in my laundry. You can put it in the regular laundry. You don't have to put it on high settings or anything like that, but you need to have a different kinds. And you can just get like scarves and stuff to put up. Bandanas are good. You just need a barrier. But I tell people, when you're looking at a good mask, make sure when you look up into the light, you can't see through it. The material should be thick enough where I can't see through it. Now that's going to be a little rough for us living in the South. And you might want to look at materials that's more cottony. I found one of them that works better for me. It's cotton on the outside and more of a terry cloth cotton on the inside to make it wick a little bit from the moisture, because we sweat in the South. I actually have the type that puts in a carbon filter in it to give me even more of a barrier. But actually in a CDC, they talked about putting 3 coffee filters in that little pocket. Mine actually have pockets to it and stuff. So.
If someone was to get coronavirus, can they be cured from corona?
There is no cure at this time. That's the reason why it's so important to do personal measures to try to keep away from it. Now, we are hoping, and we're working on it, of vaccines. Several companies are actually coming forward. One feels so confident with their vaccine, they're actually producing the vaccine before it's even completed with their studies and things. They feel that confident. But remember I told you about that SARS-1 that we had 18 years ago? They started developing a vaccine for that then and stopped because it just disappeared. So they're kind of playing on a little bit of some of the knowledge that they learned from that. Of course, this one's different. It's a SARS-2. It's different. But they can play on it. So hopefully it'll give them a little bit of leg up. Plus, the government has done some things where there's not so much red tape. It takes a long time to produce a vaccine. But we're still only expecting about a year to 2 years before we have a real viable vaccine that we can use for the public. So at this time, there's no cure, but we're hoping with a vaccine. 2 things need to occur. We've got to have a good vaccine, and we've got to have good treatments for those who get this mess. But just like the flu vaccine, I'm surprised how many people don't want to get the flu vaccine. Do you know that 20 to 60,000 people in the United States die each year from the flu?
Each year.
Even though we have a vaccine. Now, if we didn't have a vaccine, you know it would be much worse. So even though we have a vaccine, that's how many people die from it. So I'm hoping that people, when we get a good, viable vaccine, that they do it and do it like it's supposed to. Now, you're not going to get a vaccine for life for this, because coronavirus is one of those things that the body doesn't have a great memory for. So it kind of it forgets about a year or 2 afterwards. So you will, just like the influenza, you will probably have to get a yearly vaccine when we get one.
So what is the difference from coronavirus screening and an antibodies test?
Okay.
Because I get a lot of people who ask me about the test and difference of test, and one goes up your nose, one can swab. What's the difference, and do they both test for the same thing? Okay.
They test differently. The screen itself, like what you're talking about, that real long nasal swab, feels like it's going in the back of your brain. It's only for a second, though. Okay, discomfort's only for a second. It tells if you have the virus on board right now, right this second. So if I take a screen right now and it's negative, great, I'm doing fine. But let's say I go out this afternoon and I get exposed to it. That test I took that morning isn't going to tell me what I did that afternoon. It only tells you that point of time and if you're negative or positive. So we're having people, they get a negative and they like, oh yeah, I don't have to wear my mask, da, 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 you know, and then they get this stuff. So a screen only tells you if you have it. Antibody test, it takes about 1 to 3 weeks after you have the virus to be positive, but it tells you if you've had it in the past. Okay, so it's the memory part, and you built up enough antibodies for the antibody test to be positive or not. Now, if you have antibodies, don't think you're just like willy-nilly and I don't have to do anything. We don't know enough about this virus right now to know how long you're going to keep those antibodies. With the SARS-1 virus, the antibodies were around about 1 to 3 years because now we're able to have studied those people. But we're not sure about this one, and because of that, we're telling people to please, even though you've had it, to keep your distance, keep that, and stuff like that. Yeah, so that's why, you know, it's so important. But we have a lot of free testing. You can actually go, our Care Souths here in your area, your Care Souths, if you call them, a lot of them have drive-through testing. I think it's from like 9 to 2, and a lot of some of the sites have it, not all of them. But you can call them, they can tell you where the site is. It's free. This is actually paid for by the government because this is a very serious national health care crisis. And so it's actually covered under the government. So it's free. Right now you don't have to have a doctor's signature or so you don't have to be referred and you go. But you do need to call though and make sure where they are and they're accepting people.
If I think I have coronavirus, what should I do? Where should I go? Who should I call somebody?
Yeah.
Not that I have any symptoms. I'm just scared because of everything I've seen on TV. I'm frightened.
Mm-hmm.
What should I do?
Well, let me give you one positive thing. Most of them who have been tested were negative. More have been negative than positive. So that's a
good thing. It's a
good thing.
Yes.
But if you think that you might have it, first thing you've got to do is remain calm. Like I said, you may not have it. Chances are you may not have it. Go and get yourself screened though. And when you get yourself screened, wait and quarantine yourself. Don't go out. Get people to bring stuff up to the steps for you and things and run away. But quarantine yourselves. It only takes about 24 to 48 hours right now with our testing to get those results. But at that point, quarantine yourself. When you get the results, they will call you and they will tell you what to do. If it's positive, they'll tell you. Usually you have to quarantine yourself 14 days from the start of symptoms. And if it's negative, they'll just tell you, you know, this is what you need to do for your symptoms, that kind of thing. And if things don't get better or they seem to get worse, you may have to be retested. So you can, if it's severe symptoms though, please don't go to the emergency room if you think that you have it. Just think that you have it. Get yourself tested, okay? Don't just show up at the emergency room or a doctor's office and think that they're going to see you just because you think you might have it. But when should you go to the emergency room? If you've got shortness of breath and you and I are talking and I have to have a hard time breathing the whole time, that's shortness of breath, you need to go to the emergency room because that is an emergency symptom. Not just a high fever, you know, 103 and 104, excuse me, but really that shortness of breath if you just can't do it. And you can also, if you have a healthcare provider, you can call them too for advice.
Okay. During these times, these are some very troubled times. And a lot of fathers out there may be wondering, how do I take care of my family during this troubled time? What are some steps that I can take to make sure that my family is taken care of, make sure I'm taken care of, to make sure that I'm doing the right things? So what are some things that a father can do during COVID-19 to make sure that he and his family is safe?
Yeah, Dad, you have a big part because you're the leader of your family. You're the king of the household, believe it or not. So the first thing is you remain calm. Because if you get upset and you, what if this and what if that and that kind of thing, they pick up on that. So you got to remain calm. Talk to your family about trying to prevent this as best as they possibly can. One thing people, when it comes flu season, I tell people to really make sure you stay hydrated. You see me with the water.
Yes,
Keep that respiratory system good and moist, because if it's good and moist, then it's less likely to have problems as far as with this thing. One thing about these viruses, they love dry places where they can stick their claws in. So you want to have a moist environment and things for it. Also, practicing good nutrition. Right now, our fruits and vegetables are coming in. So, hey, wash them real well in water. You don't have to use soap, and please don't put Clorox on them. Please don't use Clorox on them. But wash them real good in good running water, and eating those fresh fruits and vegetables, getting those vitamins. If you don't have any problems with vitamin C, then you can take 500 milligrams of vitamin C twice a day. Some people do get diarrhea from taking vitamin C, but a good source too is also taking it into your fruits and vegetables, especially things like, we've got berries coming in, and we've got oranges coming in. Really the fresh is best, and that's where you get things, and the body takes it in better when it's taken in the nutrition. Keeping up with that, vitamin D, there has been a study with people having deficit. If you have a true deficit of vitamin D, you've been checked out by a doctor, make sure you follow their guidelines, because you want to keep that vitamin D in point. But y'all, just getting out in the sunshine 10 to 15 minutes a day, no sunscreen, 10 to 15 minutes a day. Okay, so you get good, and just kind of letting as many surfaces, so going out and having your lunch outside. I don't want you to get sunburn, no skin cancer, but in 10 to 15 minutes it's not going to happen. But it'll help for that sunshine to get with your body, so that your body can produce vitamin D. And we do have a very good study that shows that keeping that vitamin D level in line helps people not to have that really serious problems when it comes to it. So I really encourage that.
So for all of you who are just joining us, we're talking about COVID-19 or coronavirus, and we're talking about the do's and don'ts of coronavirus and some things that we can do to prevent ourselves from getting corona, some things that we can do to make sure that we don't spread the coronavirus. So we're taking advantage of our nurse practitioner.
Yeah.
Taking advantage of our nurse practitioner here. She has several titles. And so she's given us a lot of good information. For all of the participants who are watching right now, be sure to follow along as well in our man-to-man group, so that you can answer the questions that we put in the group. But also, before we continue on, don't forget, guys, we're doing this in unison or with partnership with Papa John's. And with Papa John's, it's support fathers in need. Join us in making a difference in a father's life today. You can do it today. If you go to Papa John's in Florence, they have 2 locations, one in Sumter, one in Camden. You can buy a large 2-topping pizza and a 2-liter soda for just $13. Once you do that, $1 is donated to Man to Man. But here's the deal. You must use the Man to Man promo code, which is M2M13. That's M2M13. Also, you can buy 2 large 2-topping pizzas for only $23, and $3 will be donated to Man, but we need you to use the promo code M2M23. That's M2M23. You do that in the 2 Florence locations, the Sumter, the Camden location. You support Man to Man Fatherhood Initiative, and you support fathers across the board. Father's Day is coming up, and we want to make sure that we can support the fathers and give them all the help they need, give them all the support they need, and to stand with fathers, because right now, fathers like myself, we're trying to figure out how we're going to make it through COVID-19.
Yeah.
We're trying to get on the other side.
We're going to make it together. One other thing that we were talking about, taking care of the family too, is watching out for that social media. Social media and even mainstream media have brought out some really incorrect information. If you want to get correct information, you can go to the Center of Disease Control CDC website or the South Carolina DHEC website. That will be the latest, greatest kind of information. But also, if you hear something on the social media or something on the mainstream media that doesn't quite click, there is a search engine site called www.snopes.com. If you go there and you put in maybe the information you got, like there was something that came out on mainstream media that said that this virus hates heat. It doesn't like it. So really crank up the heat in your house. and drinking hot liquids. Well, you can't survive in that type hot environment. You're talking about going over 140 degrees, okay?
No.
So we have enough problems here in the South. We can't do that. So it was really not very processed type information that they brought out. But the thing is, my caregiver almost killed my mother-in-law because she had COPD. She heard that on it, and she jacked up the heat, and then my mother-in-law couldn't breathe.
Oh my goodness.
So COPD has to have cool kind of air. So really monitor your children about that. See what they're seeing and hearing. Get involved with their conversations about it and talk through some of maybe their fears. You know, it's really kind of scary if they closed down my school and I had to go home and I miss my friends and you won't let me go over and play with Johnny and Jimmy. It's really hard. And also make sure you have about 2 to 3 weeks worth of supplies in your house, like your medicines that you may need, diapers, formula, food, and things. You don't need to be going out to the grocery store every other day. A lot of people do that, especially cooks. They like it nice, neat, and fresh.
Yes.
But be careful about that. And you might even want to think about delivery things, like Food Lions and stuff, and even Walmart. You can go online, do your order, and they can put it in your back when you go home. Then you have less likelihood of picking up something in there.
Yeah. I use that at Walmart. I like it, so they have made me a believer in ordering my food, and I can just pull up, put it in the car, and I'm going. So I like that.
Yeah,
I like
it's
that.
nice.
So I'm a sports guy.
Yeah,
I love sports. I've little side joke here, okay? Don't take it serious, folks, but it has made me sicker not to be able to see sports. And so, why have they canceled the sporting events? And I mean,
I know.
We can't. I ain't been able to watch baseball. I haven't been able to watch basketball.
Old stuff.
You know, I'm sick. I need my sports. Why have they canceled sports?
Okay, so things that have to do with group events. We know with dealing with past viruses through history that these kind of things spread and kill people when we're in group settings. So that 6 feet distance, wearing the mask, washing the hands is so important. But during a sports event, it's very hard to be separated by 6 foot. Very hard for you to be quiet in a mask, and you know that you're yelling and screaming. You're excited about your team and stuff. So it's really a place that can spread. Now, I believe they're really working hard with looking at what they can possibly do to open up sports events. But what we'll probably see is less tickets being sold, more separation of people, probably requiring masks when it comes to the fans. I don't know how they're going to get it on a football player when he's huffing and puffing, but hey, they might think of something. And then they're probably going to be testing their teams more and more and more because these teams go to different places, and we already know that if you've looked in the news and stuff, that some of the teams, you know, even down here in Columbia and stuff, some of the teams have turned out positive, several of them, and they had to be careful about practice. So it's really for the protection. Like I said, 2 things need to happen. We've got to get that vaccine, and we've got to get some treatments. If we can get those in, which I expect those in about a year to 2 at max, then maybe
you just hurt my heart again. You said a year or 2. So
but you know, you can play wiffle ball in the backyard with the kids. So you're going to have to think of things different.
Okay.
Maybe looking, you know, thank goodness we can look at past sports events and stuff.
I guess it's for the health of everybody.
But right? I tell you, they're really looking at it this fall. And I think if people will take personal responsibility first, you know, washing hands, masks, social distancing, then we'll have a better chance of having these nice events and positives. You know, churches are having to be careful, and they're doing things in phases too. Some churches are not even open yet.
Not even open yet.
But that's an event type thing.
Wow. But with the numbers are increasing now, and all of us are watching the news, and we see the large amounts of people are gathering again, and nobody seems to be wearing masks or protection. Or do you feel that's causing the spike in numbers?
It is. So here it happened in South Carolina. We had the Memorial Day weekend. So people got all excited and they went down to the beach. They didn't do social distancing and stuff. And then they had cookouts and things like that. So that increased it. Then we are coming about where more businesses are opening and people are not doing the 3 things I told you about. If you could just do those 3 things, it can make a big difference in our numbers. And then, of course, we had like protests and things. I told you, if you yell out, you're going to spread it more and doing it then and coming into those kind of crowded areas. So the first thing is you've got to take personal responsibility. South Carolina and the United States has got to open up work. We've got to work. What are you going to do? You've got to have truck drivers to bring you food. You've got to have people to take care of your youngins. You've got to work in order to supply your family. It's not a pot of gold at the end of the rainbow. We've got to all work, but we've got to work responsibly. We've got to take care of it. So it all has to do with that personal responsibility and teaching your family. You talked about the mask and stuff. That's real important when you're not able to do the 6 foot thing. It's real important to do it, especially in common areas like halls and stuff. Because what if somebody sneezed down the hall? I may not have seen them. They went around the corner, but I didn't know it. And I walk in that cloud mist that they've actually coughed into. That's where you can end up and catch it. You didn't necessarily see the person who gave it to you, but you walked into it. And that's why the mask is very important, especially in grocery stores and common areas and things like that.
Here in the South, we focus a lot on myths.
Yes.
Yes. We have a lot of myths. And I can't speak for other areas because I only know the South, right? And so, what are some myths and some truths concerning the coronavirus?
Okay. So I want to talk about some of the things that's kind of come out. One of the myths is about drugs and stuff. There is a way to prevent it, and some people have thought up actually some concoctions, and they're on TV and internet like this cures the COVID. We have no treatment for this. We have no licensed treatment nor licensed cure for this. Okay. So the FDA might have released some things to the hospital, some drugs you might be seeing in trials that we're working with, but nothing has been said, this will definitely treat this, or this will definitely cure this. So there is none. Coronavirus 19, also in the South, we need to know this. It's not transferred by houseflies or mosquitoes. They did a test on that. It cannot. You can't get it from a mosquito. So that's our state bird. We can't get it from
it. Thank you, because I live out in the country.
Right.
Farm. We have a whole army of mosquitoes.
That's right. And
I'm glad you said that.
Biting flies. They can't do it.
Great deal.
Also, spraying or introducing bleach or any other disinfectant in your body will not protect you from COVID and can be very dangerous to your body. Now, we do clean with bleach, but it's a bleach solution. I think it's like 5 tablespoons to a gallon. You can clean with bleach as long as it doesn't bleach out that material and stuff. You can bleach, but you don't put it on your fruits and vegetables. You don't put it in your body. Don't put anything, a disinfectant type thing in there.
Please do not.
Exposing yourself, like we talked about, the high temperatures. Some people believe that if I go out there and bake in the sun, then therefore it's going to prevent the coronavirus. This thing's okay with that. And that's kind of bothersome. We were hoping that in China it was a little bit colder, that once it came down here, it wouldn't mess with us down towards the equator. It's okay. It doesn't like real hot temperatures like putting in the oven, but it's okay with our regular environment and stuff, so it does. One thing is drinking alcohol. Some people believe that it will protect you from COVID. Study has shown it actually does not. It irritates your respiratory system because part of your respiratory system and your digestive system are the same for a period of time. It actually causes irritation of that tissue and can cause these viruses to actually attach to you even more so. Oh, wow. So not drinking alcohol. Cold weather, people think, well, when it's cold, it's going to go away because it ain't going to like the cold. We need a frost to come. I always talk about in the South, we need a frost to come and everything goes away. Well, believe it or not, you can put this virus in an actual ice cube. Set it in the freezer for days, take it out, let it thaw, and the virus is all alive. It's fine. It's fine. So you can't freeze it, okay, because he's okay. Some people believe in taking a hot bath or drinking liquids will help prevent it. But that's not part of it. Some people believe regularly rinsing your nose with saline, with salt water and stuff, doesn't. It really does not prevent the infection. They tried to see if maybe it would work. It doesn't. Sometimes if you continue to use it too much, you can actually irritate the tissues and stuff. So that doesn't work.
My goodness. say if a person has questions concerning the coronavirus or questions where they're testing or just any question, COVID-19 corona, how do they get answers for that?
Okay.
Is there a location or a number, something that people can call to get constant answers for
Right.
COVID-19?
If you do South Carolina DHEC website, you can look there and it actually put in COVID. It can actually tell you, just has a drop down box of each county that you're in. And it can show you each county you're in, exactly information of where you can go and who to call. Care South, their number is 843-479-1200. If you call that number for Care South and this whole PD region, they can tell you where the testing sites are, the times, and how to go, what you need to bring when you come, like your ID or whatever. They can. So.
Yeah, wow. By the way, Tyrone Edge told me to tell you hi.
Okay, good. So I miss him.
She says she misses you, Tyrone.
Yeah, I miss him.
All right, so we're pretty much done here with the coronavirus. I'm sure there are many other questions that folks have to ask. I personally thank you for traveling all the way here just to be on live with us to talk about the coronavirus. I'm certain that our viewers have gotten a lot of quality information concerning coronavirus. We hope that this information will help you guys, help the fathers, not only for you, but the information that we shared. Hopefully you will share this with your family. Share it with your friends and your brothers, your sisters, your cousins, your aunties, your uncles. Share it with everybody, because the more information, we can't have enough information, right? We need to put all the right information out there so that everybody can get access to the information. And hopefully the numbers that we are seeing spiking has a downturn, right? So that we don't continue to have a phase 1.0 or something.
It's page 20 before it's all over.
Right. So we want to keep those numbers down. You have any questions or anything you want to say before we end the segment?
Just everybody continue. I know right now we've opened everything up, but you've got to still stay vigilant as far as yourself and your family. Talk about things on a regular basis. This is a great time, though, to families to interact with one another. But keeping those things that I told you about, the principles, keeping 6 feet apart from people who are not in your household, and also with your masks and your hand washing. Hand washing needs to be good, though, 20 minutes. Or using hand sanitizer. If you make your own hand sanitizer, it needs to be alcohol content of 60% or above. Alcohol is the #1 ingredient in any hand sanitizer because it actually does kill the virus. So 60% or above as far as alcohol, and then you can put other type things in it like aloe or something like that to help.
Made our own here, man to man.
Yeah, they have a still in the back, but that's okay. No, they're doing great, and that helps the community. Because it's hard to get. It's really hard to get.
It is hard to get.
But take care of yourselves and your family. I hope you guys have a great, happy Father's Day as you come up. It's a different Father's Day.
Different kind of Father's Day.
If you're going to have some things out, have it outside, guys, because it's less likely this virus will travel outside. So you got cookouts and stuff. Have it outside. If other people are coming, have them to bring their own drinks or their own foods. That helps a lot. But if you're having somebody serve, have 1 or 2 people serve, wearing gloves and dishing it out. These buffets and using, like we do in the South, everybody just picks up a spoon and keeps picking up the spoon, then you're more likely to travel not only this disease, but other things and stuff. But keeping the guidelines, keeping it great. I know we love to hug in the South, and it's really hard right now, but we're doing the best we can, and just really think smart.
And I want to personally say to the fathers, we support you. To the fathers who are maybe having a tough time, maybe you're going through a situation and you feel like you're going through it alone. I'm here to let you know you don't have to go through that alone. Man to Man is here. The same way you're watching this video, you can message us and we will get in contact with us. Be sure to leave us your contact information. We will reach out to you, whether it be a job, maybe you're having issues in the home, maybe you are having some child support issues. Maybe you're having some emotional issues. Maybe you're having some physical issues to where your health is not up to par or where you would like it to be. Because if you're not physically healthy, it's going to be hard for you to maintain a full-time job. We will work with you. We will stand with you. We will walk with you every single step of the way. I'm here to let you know, if you are a father, you do not have to walk alone. We have your back. So reach out to Man to Man. A healthy father is an asset to the family. Be sure to visit our webpage, www.mantomanfathers.com. You can read all the information there about the fatherhood. And again, I want to send a shout out to the Center for Fathers and Families. Also, a Father's Place, Father to Father, Father's Way, Upstate Fatherhood Coalition, Midlands Fatherhood Coalition, and of course here at Man to Man, we're all in this together. COVID-19, out. That was really good. That was really good. Wow, it's a lot of information. A lot of great information.
Yeah.
I enjoyed it.
Good.
Yeah, just a lot of good information. I enjoyed it. I thoroughly did.
Good.
Yeah.
Good. I'm gonna stay well.
Yeah, and I'll definitely be taking heed to a lot of the stuff that you said here, because there was some of the